Welcome back, welcome back, welcome back. We have an amazing episode for you guys today. This applies to, unfortunately, far too many people out there. And if it doesn't apply to you, you probably know someone it might apply to. So we have a great conversation with a fabulous doc today. We're talking about metabolic health. But before we get there, obviously would love to invite you to head over to natnidham.com. Sign up for the newsletter, whether you sign up for the general newsletter, the peptide newsletter, or both. And definitely, if you're interested in hanging out with me, doing some live Q&As, getting early access to podcasts, and connecting with other amazing experts who've been featured on this podcast, check out the longevity community. There's a tab at the top of the page on the website. We would love to see you there. And of course, if you get value from this episode and you enjoy it, make sure that you share it with other people who you think would get value from it. And if you've got a second, please leave us a review, because that is how we get found by people just like you. I know I'm not telling you anything you don't know if I tell you that 80% of Americans are metabolically unhealthy. What a statistic. That is insane. That means that most people are already on the road to chronic illness. They just don't know it yet. Now, my guest today, Dr. Robert Lufkin, knows this better than pretty much anyone. A physician and medical school professor at UCLA and USC, he spent years teaching the very concepts that he now challenges in his New York Times bestselling book, Lies I Taught in Med School. What a title. Today, he's here to break down how modern medicine has it all backwards, why your annual checkup might be missing the bigger picture, and how simple lifestyle shifts can literally turn back the clock. We're talking about the big four here. We're talking about hypertension, type 2 diabetes, cardiovascular disease, and, wait for it, gout. Yeah, gout. Turns out that all of these have a common root cause, and we're breaking it all down with someone who's been on both sides of the exam room. Let's get into it. Hey, folks, just a quick reminder that all of the information presented in this podcast is for information purposes only. No medical advice, no diagnosing, no treatments suggested here. Before you try anything that you hear about or learn about here, make sure that you check with your medical provider. Welcome to the show, Dr. Lufkin. It is a pleasure to have you here.
Hey, Natalie, it's great to be on your program. I'm a fan of your work, so it's an honor and a pleasure to be here.
Thank you. Well, it's an honor and pleasure to have you. So, it was a fortuitous thing that we got introduced, and I'm seriously looking forward to this conversation. It's funny how things happen sometimes, right? You get introduced, then you end up at a conference, at the same conference, and it just, all the stars just seem to align. So we are gathered here today, to talk about your book, but really to talk about what's in the book, which is, I think it's a storyline that is becoming, fortunately, better and better understood and heard, I think, more broadly in the health space by the consumer. And we can only hope maybe even by practitioners. And as I was saying to you before the podcast, I just love the title, Lies I Taught in Medical School, because you're uniquely positioned to have this conversation as someone who's trained physicians, or probably still does train physicians in med school, and is also a clinician himself. So what got you here? I kind of read it a little bit in the book, but I'd love you to share with the audience. I mean, we're not going to give away the whole book, guys. You're going to want to read this because it's a great read. I haven't read the whole thing, but even just going through the material I've gone through, it's an easy book to read. Like, it's just really nice information.
Yeah. Great question. Well, first of all, for perspective, as you said, I'm not a conspiracy theorist. I'm not a medical outsider. I am basically a representative of the medical establishment. I've spent my whole career as a professor at, leading medical schools. I've written hundreds of peer-reviewed papers. My lab has gotten millions of dollars from drug companies and device makers and the federal government to do research about healthcare. I've had the honor and privilege of educating students and doctors in training, and also the honor of practicing medicine. So I am part of the system. And the book, as we'll find out, is critical of Western medicine. But before we get into that, I want to just say a disclaimer. I think I'm a huge fan of Western medicine. I think it has transformed our lives in the 20th century, the lives of all of us around the world, largely through the eradication of infectious disease and public health measures and the treatment of acute conditions. And there's pills and surgeries that really save lives and make the world truly a better place. And even today, if I get hit by a car out in front, lifestyle will be important for healing, and we'll talk about lifestyle, but what will save my life is Western medicine. I will need a blood transfusion. I'll need a splenectomy. I'll need my bones set. So Western medicine, even today, still plays an important role. But the problem is, and what my book strives to address is, in the 21st century, we're facing now a tsunami of chronic diseases that, while they were around in the 20th century, they're nowhere near in numbers or percentages that we're seeing today. These chronic diseases include, obesity. Most people are overweight or fat. Hypertension. Most people have hypertension. Diabetes now. Most people are pre-diabetic or diabetic, but on and on. Cardiovascular disease, cancer, Alzheimer's disease, and even mental illness are exploding in the numbers. And the problem is, when Western medicine takes the tools that were so magical and transformative and so effective in the 20th century against infectious disease and acute conditions, when we apply those same pills and surgery to these chronic diseases, they don't always work, as evidenced by the fact that these diseases are getting worse and worse. And to be clear, the pills and surgery may be life-saving in the short term. If I'm a diabetic and my insulin or my glucose is through the roof, insulin will save my life. But if I go on as a type 2 diabetic to a lifetime of injecting insulin, that is the chronic downstream effects of diabetes. Many of them will not be reversed by the insulin and will continue to get worse. So that's really that's the premise of the book. But how I was drawn into this was, I'd like to say, well, I want to make the world a better place or something, but no, it wasn't that way at all. I was minding my own business, doing my own thing when I came down with 4 of these chronic diseases myself. And suddenly, it became real, and I went to my doctors, and they prescribed prescription medicines for each one of them. And we talked about a lot of things. I said, what about lifestyle? I said, it doesn't really work. You're going to need to take these pills for the rest of your life, so get used to it. And I knew that wasn't going to end well. So it forced me to really examine what I believed and what many of my colleagues believed, and actually dive deep in some of the latest research. And I realized that things are changing, that many of the things that I believed were true are not true. And many of the things that I taught and are still being taught in medical school are untrue. And thus the title, Lies I Taught in Medical School.
I think that where you're coming from is the magic of the book. I think the fact that you are part of this establishment is the magic of this book, because it's too easy. I think too often it's too easy for people from the outside to criticize, and to have a voice of someone who is in the system, who has appreciation for what the system does well and recognizes that there are shortcomings. Like, I think that's how change can actually happen. Right. I think it's too easy. It would be so easy, and it is so easy for the system to say, you don't know anything about what you're talking about. You're not a doctor. You've never gone to med school. You don't know what you're dealing with, and therefore we can dismiss you. But when it comes from one of their own, someone who's so deeply embedded and who has appreciation for the system, I think that's the power of the book that you've written and your voice. So I think we're all very lucky that you had that kind of wake up call, right? And the 4 things you're talking about, I think it was hypertension, type 2 diabetes, cardiovascular disease, and I don't remember what the 4th one was.
Gout, a type of arthritis.
Right? So these are like standard, run of the mill. You're getting older, your metabolism is becoming less flexible, and it's one of those things that I'm sure your doctor kind of said to you, yeah, well, you know what, Rob, you're getting a little longer in the tooth, and this is just what happens when you get older. And you know, this narrative that diet and lifestyle isn't going to change anything, I think there's two parts to that. I think part of it is that many doctors don't believe, but the other part of it is that they're often sitting across the table from a consumer who is not interested or doesn't also believe that it can be done.
Yeah, exactly. That's a great point, Natalie, because I mean, hey, I'm basically lazy too. If I go into a doctor's office, I'd rather have a pill than a lecture about what I should eat and exercise and all this stuff. And so the problem is, and this is the added nuance that a lot of people aren't aware of, is that the pills and surgeries, they may save your life in the moment or take care of the acute symptoms, but they really don't address the underlying so-called root cause. And it's that lifestyle isn't an alternative to pills and surgery. You can do one or the other, because pills and surgery don't work for the root causes of many of these diseases. And if you just take the pill or just take the surgery, the disease will continue to progress. Many of the symptoms will get worse, even though you're feeling better and you feel, well, I'm taking a pill, no worries, right? And that's really the danger. And it was a wake-up call for me that this healthy lifestyle, this so-called metabolically healthy lifestyle, is really the only thing that fundamentally, or a major thing that will fundamentally reverse or slow down these chronic diseases, when the pills or the surgery may not. And that's really the danger. And the other fascinating thing is that you'd think, well, I've got Alzheimer's, I should do this kind of lifestyle, or I've got cardiovascular disease, I should do this diet or this lifestyle. The thing that's amazing is the same thing, the same lifestyle choices, the same metabolically healthy diet and living will you'll lose weight, your type 2 diabetes will go into remission, your cardiovascular disease risk will drop, cancer risk, Alzheimer's disease, and even mental illness changes. It's something, we're basically metabolically ill. According to some studies, 80% of Americans have at least one of these root metabolic factors that at a basic level drive all those diseases, things like insulin resistance, inflammation, and oxidation. Mm-hmm. And this message is not being communicated well, or even people aren't even aware of it in most medical schools today. And the book is aimed at a general audience. There are a lot of pictures and drawings and illustrations of me and my dog and different things like that. But but also as a scientist, I'm very clear to list a lot of references, like hundreds of references. Right. That are at the end of the book, thankfully, so they don't interfere with reading. But the references are original articles. They're peer-reviewed studies, because this is all about how we interpret the research. And this is my interpretation of the research, which I believe is right, and I make the arguments why it is. But the book is aimed, if people want to dive in, they can go to the same articles that I read, the same basic research papers, or they can take a copy of the book and hand it to their physician and say, this doctor thinks fatty liver disease, non-alcoholic fatty liver disease, which didn't exist before 1980 and is now the number one liver disease in the world, or in the U.S., and number one cause of liver transplants. This doctor thinks it can be reversed, and the only advice I'm getting from my medical school is just to eat less fat, and which is not the way to go, as we talk about in the book.
As I eat more carbs and keep drinking my wine with my pasta. And shockingly, generating foie gras.
Yeah. How do you make foie gras in a goose? You don't feed them fat. You feed them sugar, figs, carbohydrates, and all that.
100%. And in that case, we are a lot like geese. So, all right. So let's talk a little bit about some of these foundational things, because as you pointed out, it's not like you need a different approach for particularly for different things. You don't need. There's not a different prescription for type 2 diabetes or obesity or cardiovascular disease or fatty liver disease or hypertension, and then shockingly, even mental health to a point. I mean, mental health is maybe a bit more complex, but nevertheless, if we're metabolically unhealthy, our chances of having some kind of mental health issue goes through the roof. Plus, the mental health issue gets a lot harder to treat. I would.
Absolutely. And to speaking to that, the four diseases I had, I went to essentially four different specialists, because modern medical education is very siloed. You have a brain specialist, endocrinologist, a rheumatologist, and that's a very powerful having various specializations, but it keeps people from seeing the big picture. And the amazing thing was the same metabolically healthy choices that I made in my lifestyle reversed all four of those seemingly, on the surface at least, unrelated diseases, to the point that I didn't need the medications anymore. My doctors couldn't believe it. They thought there was a mistake in the labs. But I and many people, it's been shown in controlled trials, it's not anecdotal at this point, can reverse many of these diseases. And I'm not, to be clear, I'm not recommending anyone discontinue prescribed medicines that their physicians has recommended to them, but do that in conjunction with your healthcare provider. And this whole phenomena of deprescribing, which is something I never heard of when I went to medical school, because nobody ever, you got put on a drug, you were on it for life. Yeah. But now, as we're understanding metabolic health, and we can adopt the metabolically healthy lifestyle, and suddenly the blood pressure medicines you may not need anymore, the diabetes medicines, your metformin, your insulin, your gout medicines, or your, on and on and on. So it's an amazing time we're living in.
Yeah, it is an amazing time. And, I wonder if maybe at some point the idea might have been, because as you're talking, I'm sitting here thinking, wouldn't it be great if people had a medical quarterback? And so basically, I mean, there is value in specialists in certain instances, right? Like, not everybody can know everything about every system, but what you really need at that point, maybe the intention at some point was that a person's GP would be the point of contact where all of this information from the different specialists might be coming in, and might be able to make sense of it, or connect the dots, or maybe pick up the phone and call a couple of specialists and have a conversation as a group and say, wow, like, it just so happens that Bob's diet is affecting his this and his kidneys and his liver and his that and the other thing. And maybe if we just got Bob to change his lifestyle a little bit, why don't we hold off on whatever the drug is, whether it's statins or insulin, and give Bob 3 months to see if he can start moving the ship over, kind of thing.
Absolutely. General practitioners, family medicine, primary care, these people really are, play a wonderful role in this quarterback position. But part of it is the system. If I have 7 minutes to see a patient, I'm going to skim through their chart and have a brief conversation for them. And if their glucose is high, I'm going to prescribe, which is a sign of diabetes, I'll prescribe the diabetes drugs. I don't have the time, or the system doesn't allow me to set up with a conversation about lifestyle. The other thing, out of fairness to the doctors, and just underscoring the challenge we all face, and I think it's really a new era in medicine. Before, certainly when I was growing up, you go to a doctor and he or she, dictates what to do, and you follow their advice, and you follow it with a pill or surgery or whatever. And today, it's a new era in medicine. As a patient, I'm able to decide my lifestyle. I mean, I always was, but now we realize how fundamental lifestyle is. And lifestyle is something that a doctor can't make lifestyle choices for me. They can suggest things, but at the end of the day, I'm the one. I have agency. Every morning when I get up, I get to decide what I eat, when I exercise, when I do whatever. And suddenly I become the quarterback of my own life. And the physician certainly has expertise in their area. And it may be a broad area, it might be a narrow area, but they have valuable expertise that could save my life. But I also, as a patient, have expertise that the physician will never have. In other words, I know about my life in totality, including childhood traumas and that weird fracture I had when I was 10 that, no one asked me about, or the fact that I sleep in sheets made out of plastic, or that I drink unfiltered water, or that, there's mold in my basement, and you just don't have time to get into that in a 7-minute interview with a physician. Yet as a patient, I have that information. So it's a great time. It's a challenge, but it's a great time that patients now get to take control of their life through their lifestyle and through beginning to ask more complex questions. And AI will help with that as well. But it's a new era in the doctor-patient relationship. I become the CEO of my own health, and the doctors are advisors, and they can give me good advice, but they don't give me all the advice I need.
Yeah. No, I think that's a great point. I mean, it's a best case scenario, right? And I think that, unfortunately, at this stage of the game, there are the doctor. I mean, you make a great point. The doctors they're not incentivized. They haven't been trained in a way that says, this is your new role, right?
Yeah.
Your new role is not to give a pill for an ill. Your new role is to work with the patient to find, to understand what is this patient willing to do, and to encourage them and point them to resources to help them to do it, and give them agency, because not every doctor is willing to hand that over. I'm sure that there's a group of doctors out there that goes, oh my God, my job used to be so much easier. It used to be they would come in, I would just get to tell them what to do. I'd look at the blood work, and bada bing, bada boom, you're out the door in 7 minutes. Whereas today's patient, in many cases, is much better informed. Maybe they know enough to be dangerous, whatever however you want to look at it. And it requires a conversation. Like it requires more than 7 minutes. And to that end, do you think maybe what might be great would be almost if physicians, or if we somehow produced a list of a cheat sheet that people could go into their doctors with, of relevant information that goes beyond your red blood cell count. It goes beyond what was your blood sugar, what was your fasting glucose on this day. And that actually gives the doctor this relevant information, like you just said.
That's a great point. I mean, there's still the overlay of paternalism in medicine. In many states in the United States, physicians are not allowed to access their medical records, without the permission of the doctor. They don't own their medical records. But your point is really important. But it sort of uncovered another thing that was shocking to me, or that I wasn't aware of to the extent that I am now. And that was that modern medicine is set up with diagnostic criteria. You go to your doctor. You don't go to your doctor to get healthy. You go to your doctor to get less sick. Your doctor can't make you healthy. Your doctor can just make you less sick. Why is that? Because you only go to your doctor when you have a certain problem, typically. So, and let's take diabetes as an example. Diabetes is a disorder of glucose. Used to be, there's type 1 diabetes, which is the small number now, but type 2 is just exploding, up to the point in some studies, half people are diabetic or pre-diabetic. And the problem with diabetes is that it has many downstream side effects. Number one cause of amputation, surgical. The number one cause of blindness. The number one cause of renal failure. It's all diabetes and heart disease and mental illness, and all of the other chronic diseases are made worse with diabetes. The way we diagnose diabetes is a test called hemoglobin A1C. There's some other ones, but that's sort of the standard one. The hemoglobin A1C measures damage to our red blood cells from sugar. Sugar in our blood damages our cells through something called glycation. And when we get spikes of sugar, largely from carbohydrate meals, that causes damage. And the hemoglobin A1C as a percentage gets higher and higher the closer you get to diabetes. And there's a cutoff where when you get above a certain level, then the doctor can say, yep, you're diabetic, and I can prescribe this, and I can code this as a diabetes visit, and all sorts of things happen. That's the way the medical system is. But it ignores the fact that type 2 diabetes, and in fact, every single one of the chronic diseases that I just mentioned, it's not an on-off switch. In other words, it doesn't, one morning you wake up and your doctor says you have diabetes and a week ago you didn't. No, these chronic diseases typically occur days to weeks to years to decades before they get diagnosed by the doctor. So your hemoglobin A1C is creeping up and up and up and up and up and up like that. And similar, all the diseases. So the great thing about these lifestyle strategies and a metabolically healthy lifestyle will slow down, delay the progression of all these diseases. So these markers, and even you can say, I have a friend who says, hey, I'm as healthy as I'm healthy as anything. I'm 70 years old. I go to my doctor and he says, you don't have anything to worry about. All your labs are great. You're on no medicines. But then I look at his labs, and his hemoglobin A1C is just below type 2 diabetes. He's not there yet, but he will be in another 6 months or something, or pre-diabetes. And his blood pressure is in the normal range, but it's high. You can see all these markers that are getting ready to go. And that kind of prevention mindset is not, it's really a disservice when your doctor says, hey, you don't have anything to worry about, you're fine. Yeah. That's not true. Most of us are not fine given the lifestyle we lead. And I think we all need to pay attention to it. Yeah. Type 2 diabetes, just one other thought on that. As a physician, I used to think of that as a disease that, you either get it or you don't get it. If you get it, hey, maybe it's your parents, it's, or too much sugar or whatever. But, too bad. But, and if you get it, and if you don't get it, good for you. There's an interesting study that just came out that we talk about in the book. It's from, tens of thousands of patients from the Framingham data and the NHANES data. These are non-diabetic adult Americans. And it shows that over time, with age, the hemoglobin A1C gets higher and higher and higher. So what does that mean? It means that now the way I think of it now is type 2 diabetes, it's like, it's like wrinkles. Mm-hmm. In other words, if I live long enough and I don't die of something else, I'm going to get wrinkles. And same thing with type 2 diabetes, because we're all on the path to insulin resistance. So what is that? How does that influence me now? Well, that's an incentive to be on a metabolically healthy diet, which will and lifestyle, which will decrease my chance of type 2 diabetes and decrease my chance of all the other chronic diseases.
Yeah, that's a great point. I think it's, it's funny. As I'm listening to you, I'm thinking, it's funny because in some ways it is true. Oh, you're 60 years old, you're more insulin resistant. Oh, you're this age, you're going to hurt more. What's missing from that sentence, like what you're basically saying, is that the human body becomes more insulin resistant as it ages. We know that women after menopause become insulin resistant. Their chance of cardiovascular disease goes up. Like all of these different things start to happen. Men are not that different. The part that's missing from that is, but if you exercise in a certain way, if you eat in a certain way, if you sleep enough, there are things you can do to offset. And what that means is we almost have to earn the privilege to get old and stay healthy. You can kind of feel healthy and look healthy when you're younger with comparatively less effort. But as we age, we have to earn that privilege. That literally just popped into my head, which sounds a little bit horrible, but it just means you have to kind of lean into it a little bit, and you have to honor the fact that you've made it this far, and you don't get to do things like you did. And frankly, that kind of that not great lifestyle that you lived earlier that you thought you were getting away with, this calls back to something you said earlier. You weren't getting away with it. It just wasn't showing up yet. those were the building blocks of what you're seeing when you're older.
Yeah, and many of the phenotypes or appearances of old age, we go, oh, that's just an old person. Well, what is that? Well, like people who, some people when they get older, they get bent over and they get shorter. They literally get shorter. That's not old age. That's osteoporosis with collapse of the vertebral bodies. That, sure, older people have a higher incidence of osteoporosis, but not all people get that when they age. And similarly, brain fog, like, not long ago, we had two 80-year-old politicians and, one was taken to task because he, running for president, obviously. And one of them was taken to task because he kept forgetting things. And that says, well, he's 80 years old. And no. Brain fog and memory loss is not part of aging. If you have that, it's something else. So,
and you can do something about it. Like
exactly.
The thing is,
it's not
an
inevitable
thing. Yeah, it doesn't. Anyway, we're not going to talk about that. That's just a bad dark hole. We're just not going to go down. But so, you mentioned early childhood events as being ACEs, right? Early childhood events as being impactful, and I think it's important for the audience for us to understand that everything that happens in our life is part of our. It's just, I don't even want to call it baggage, but it's part of the package, right? And it may play a role in how you age. And so in this world, being at RadFest with you this weekend, like there are scientists and researchers doing the most amazing work, right? Like Dr. Gordon, I mean, what he's doing, I was like, my jaw was on the floor. I just could not believe, like, this man is, just to give you guys a little bit of insight, and this is going to be ridiculously oversimplified, but he's finding ways and researching ways, and dare I say, he's kind of done it in people, but, still very experimental, where he will take exosomes, which are basically communicate messenger molecules that come with stem cells, injecting them into a person, and then using technology to direct those exosomes into a part of the brain that directs the aging clock and reversing that clock. And if you think this sounds phantasmagorical, it kind of is. And it seems to be, at least initially, it sure seems to be a thing. So, but the thing is that for that to work, for people to have access to that, you got to do the work. You got to be healthy. Like, you got to keep yourself together.
Yeah, his Shelley Jordan stuff is cutting edge. I'm thinking of doing it myself. Actually, we'll see. But I loved your comment about lifestyle and early childhood events, ACE events, so to speak. And stress is a number one factor. Stress, mindset, and you can get your diet together, you can get your sleep together, you can get your exercise together. But if you miss one thing, and all the brain stimulation and exosomes in the world isn't going to make up for it. And the thing about stress is just, it's fascinating, is that the stress isn't about what happens to me in the world. Yeah. It's rather about how I interpret what happens to me in the world. So, if I have a painful operation and it hurts and everything, it's very stressful, and maybe I'm dying of cancer, and it's just a horrible event to go through. The same person, a different person could have the same operation or similar operation, same amount of pain, and it would be a joyous event. Why is that? Because it's the birth of their child through a C-section or something. And so it's very much, but getting back to the early childhood events, the reality that we experience is literally is laid down by our early childhood events. If we get bitten by a dog, then we see a dog, we're going to feel stress, or, much more convoluted and nuanced but the world we create and the lens through which we see reality through the rest of our lives are influenced by these early life experiences. Is the world a loving place, forgiving place, or is the world a dangerous place that I need to watch out for? And it's almost that the reality we've created for ourselves, the filters, help create the reality we experience. Because if I'm expecting, the experiments about this, but if I'm expecting dangerous things, I will go out on the street and I will see dangerous things and I will go, yeah, this is really a dangerous street, but on the other hand, if I'm expecting the world to be loving, and I will go out and, my God, it's a beautiful day, the sun's shining, beautiful people, and we experience things so differently. And these patterns replay throughout our lives. And that's the power of, changing the default mode network with meditation or psychedelics. We can get out of those grooves and in a sense, change our reality, momentarily, but some of the effects are long-term, with PTSD and depression, and, it's an amazing, amazing thing.
Well, I 100%. And I think what the takeaway for the audience, because now somebody might be sitting there going, yeah, well, I had a really crappy childhood, I'm screwed. No, like the thing is that if you acknowledge it, if you're able to look back and acknowledge it, find a guide or a physician or a counselor or a coach or someone who can, those default mode networks can be reshaped. You can change this for yourself. It might take some work and it might take some time, and there's different ways of going about it, but all of this stuff can be influenced if you recognize it and if you acknowledge it. There's nothing like turning around and looking the beast in the eye and saying, I see you, and then making a decision about how you're going to move forward in the world. So I think these are really, really important points to highlight to people that you can change. Like, you can change the impact of those ACEs on your today by doing the work. It's, it will have affected you until now. As you said, stress, the big killer, because why? Because it affects your metabolism, it affects your sleep, it affects your immune system. It affects all the things that we're talking about right now.
And it's important, I think, as a healthy growing up and aging, it's healthy to continually re-examine your life. And you may be 50, 60, 70 years old and say, well, my life's great. I don't have anything to worry about. But that's why I think, more and more of these things are becoming available in a medical setting, things like ketamine and soon MDMA, these psychedelics that can, under the right set and setting, do amazing things that people should, I think people should continually be open to that. And thankfully, there's going to be more and more opportunities to do things with those.
Okay. Yeah, no, 100%. All right. So let's give people, we've had a really great philosophical discussion right now. And I'm sure that people are sitting there, they're listening, they're going, yeah, oh, yes, that too. And yes. And now let's give them some idea about what to do. Because I'd love to leave people with some actionable information. Right. And so, again, from where you are, you've done research, you've taught med school, you've been a physician, like you've been in that, you come to us from the trenches. And so let's talk a little bit about what are things that people can actually do. And maybe let's get a little bit more specific, but without getting, it's funny with diet. Actually, let me ask you this. When it comes to diet and nutrition, what do you think? Because we have polarization in the world about pretty much everything, and diet is I think maybe diet people, you could put a couple of people in a room and there'd be nobody left alive at the end of it if they're from different camps. But let's talk a little bit about what's your view on diet? What have you seen in studies and clinically?
Full disclosure, my mom was a dietitian, so she worked at a hospital and as a dietitian, nutritionist. They were the experts on nutrition. Doctors weren't taught and still are not taught much about nutrition in their training. Mm-hmm. And we followed the food pyramid and all the official dietitian recommendations for food, which unfortunately are very unhealthy. And only later did I realize that the dietitian profession it was basically started by a strong religious group that had a particular nutritional agenda. I have nothing against religion, everybody to their own, but anytime a scientific organization at least was founded with a strong nutritional agenda, that you don't need that kind of influence. It should be based on the science. And even today, nutritional information, the American Dietetic Association, is largely funded by junk food makers. You go to their conferences, and you have Coca-Cola and McDonald's there, and they're producing the education. And not surprisingly, we had this thing called the food pyramid a few years ago, which were the dietary guidelines for the United States, which doesn't seem like a big deal, but it actually drove dietary practices around the world. It determined what kids are fed in their school meals, what, the military people are fed, prisoners are fed, and eventually everyone followed suit. And if you look at the dietary pyramid, the bottom row is what you're supposed to eat the most of, and then less and less and less. And recently, Nina Teicholz and others published a paper showing the conflicts, the professional conflicts of the authors of these guidelines, and they were basically conflicted with. They were all, not all of them, but a large number were from junk food makers. But if you look at the dietary pyramid, the bottom line, what you're supposed to eat most of is junk food. It's basically cereal and grains and breads and things like that, and it influences us at a very basic level. So food, I think, is really important. Nutrition is important. It's the one medicine that we put in our mouths every day, almost everybody on earth. And I think it's one of the most powerful things we can do to change. But I think the modern recommendations about diet are, that's better.
I think your dog has an opinion about this.
Yes. The modern recommendations about diet are the official ones. The food pyramid, I disagree with. As you mentioned, there's a politicization of, carnivores don't talk to vegans, just like, one political party doesn't talk to another. Personally, I love my vegan friends. I love my carnivore friends. And I think either one of those diets can be very healthy or very unhealthy, depending on the food choices you make within those. I think it's harder to be healthy on a vegan diet just because of it's harder to get good nutrition and nutrients from those, but it's possible. But I think it's all about eliminating certain foods and junk foods. And junk foods are high in refined carbohydrates and sugar. They're high in refined oils, so-called seed oils. And I think the other problem is grains also, that, those contribute to a lot of inflammation in people who don't have full-on celiac disease, or anything like that. But that don't have a problem with gluten, but there are other proteins in the grains. And in the United States, our grains are soaked in a weed killer called glyphosate, which is outlawed in, many European countries because they believe it causes cancer.
Yeah, amongst other things. So, so what I'm hearing you say is you're an advocate of a whole food diet, stay away from the junk food, stay away from the packaged foods, really. And I mean, I'm a devoted omnivore. That's just my jam. I think that if people as a starting point went there and just ate, not fruits and vegetables and your healthy proteins and your healthy fats and maybe a little bit of fruit, then that's okay. I think that, what do you think about the idea that from an evolutionary perspective, our primitive brain goes to sugar because it's a rich source of energy, of fast energy. And the food and big food industry has tapped into that by making all these snack foods that are very carb heavy, very salty, very sweet, and it triggers that primitive brain, and it almost, like, to me, it's almost like an addiction, and it's very hard to have a little bit. Right? There was that ad years and years ago. What was it? Ruffles potato chips. You can't just have one. But it's true. You can't just have one.
Oh, it is truly an addiction. That's why the anti-addiction, the literally drugs, low-dose naltrexone, works on sugar addiction. So it's a definite addiction. But you're right. It was evolutionarily, sugars, particularly fructose, were necessary for survival. If there's fruit on the trees, you better eat as much of them as you can and put on weight, because winter's coming and you're going to need to survive. And those of our ancestors who didn't survive, they didn't pass on the gene. But going back even more, the one thing I talk about in the book is a basic longevity health signaling protein called mTOR, and we talk about how mTOR is turned on for growth when there's food and nutrients, and it's turned off for repair and autophagy when there's no food and nutrients. And both of these are healthy states. But interestingly, in the early life, as hunter-gatherers, before 10,000 years ago, before the agricultural revolution, most people believe we typically went through periods of fasting and eating and fasting. In that case, mTOR was turned on when the nutrients were there, when we were eating our meat. And then we'd hunt for a week or two, or, there would be a pause in the eating. And that had a healthy swing in mTOR. About 10,000 years ago, the agricultural revolution came, and food became more generally available, especially, grains, obviously. And this only got worse 100 years ago with refrigeration. And then it even accelerated until the 1980s. Something happened with junk food, high fructose corn syrup, and all these things to where now we're literally eating all the time, and mTOR is turned on all the time, which is growth mode. And you need to have that autophagy. You need to have that repair. And to the point that you can actually, the lifestyle strategies, the metabolically healthy lifestyle strategies we talked about actually turn mTOR into that healthy position, into that healthy off switch that let our bodies heal, let the autophagy go. And the most powerful anti-aging drug ever discovered so far, at least, that prolongs life in every organism it's ever been tested in repeatedly up until mammals, is rapamycin. And rapamycin was how mTOR was discovered, because mTOR is the mechanistic target of rapamycin. So and rapamycin turns mTOR into that favorable state with autophagy, just like a metabolically healthy diet does as well.
Right. So what are your thoughts on fasting for people? Because that's where this is going, really. And you said it a minute ago, back from an evolutionary perspective, we would have gone through times of feasting and fasting. And there's a beautiful dialogue around that, where we should, even ourselves, essentially mimic those periods where we eat more and then periods where we eat less. But we have to design it because, for most of us who are fortunate, we live at this eternal buffet, like the 24-hour buffet, 7 days a week kind of thing. And so what are your views on fasting for people in general, which I think in many ways, properly done, fasting properly will address every one of these conditions that we're talking about here?
Yeah, I think fasting is one of the healthiest things we can do. And I love to quote Jason Fung, who is a fasting expert. He wrote the foreword in my book and has written many, many books on that. But he said, back to religion again. He said there's one thing that all religious leaders of the world agree on, whether it's the Buddha or Muhammad or Jesus or anyone, and it's not a spiritual concept. The one thing we agree on is that fasting is part of a healthy life, and almost all religions have fasting in it. So I think, yeah, absolutely, it has so many healthy effects. And even cutting out snacks is the first thing to do. Just cutting out between meal snacks. When you eat dinner, brush your teeth, and then don't eat anything else. And if you're up for it, skip breakfast and then extend that fast a little bit, and skip lunch too if you want. And then you've got almost a 20-hour fast. That's what I do most days, just a one meal a day thing when my kids get home from school. And people say, well, how can you do that? Isn't that a strain? And you know what? I do it because I never felt better. I used to get like brain fog and, tired and stuff. And now my mind is crystal clear. It's sharp. And I was talking with some friends about what might be the mechanism for that, because people who are fasting and on this metabolically healthy diet, they notice anecdotally, that their vision is better, their hearing is better, and definitely their mind is clearer. And somebody would have said, well, you have hundreds of thousands of years selecting. If you're a hunter-gatherer and you're fasting, you need to turn up your brain, turn on your eyes. You got to be an apex predator to survive. And the ones who didn't do that didn't pass on the genes. So we're getting all the genes. When we fast, then suddenly we're alert. And the other thing, they say, well, how can how do you have the willpower to do it? Well, I don't have a willpower. It's just when you fast, you go into a metabolic state called ketosis, a healthy metabolic state, which suppresses your appetite. So I don't miss breakfast at all or lunch most days because I'm in ketosis. And the great thing about fasting is I get one thing that is priceless, and that's more time in the day. Mm-hmm. And I also get more money in the day because I save, I'm arguably eating the same, but at least I'm not, going snacking at a restaurant for lunch or, something like that. So,
I mean, all really great points. And I think fasting might look a little different for different people. And as you said, for someone who's not and we get into this area of metabolic flexibility, the body's ability to switch between fuel sources, between ketones and glucose. And for some people, your first step might be it's like exercising a muscle. And so being able to go between breakfast and lunch without having a snack, and then lunch and dinner without having a snack, then saying, okay, dinner, I'm going to be done eating at 7:00. I'm not going to eat again until I wake up in the morning. And that might be enough for some people. And then finding your perfect window. And, there's some research I'm sure you've seen that says that for women, maybe we're better off eating a protein breakfast, maybe skipping the last meal of the day. I think the point I'm making is there's many different ways to skin a cat, but definitely not eating sometimes can be really, really good for you. There's a couple of things that Jason Fung has said that have never left me. There's one where he was having a conversation about parents and their kids at soccer, and they're chasing their kids around the soccer field with snacks. And the kids are like, I don't need a snack. I'm playing soccer. And the parents are like, no, you need to have a donut. You need energy. And we beat metabolic flexibility out of our kids trying to do good. So
right.
I do think that it's, it's getting this idea of really understanding what is a nutrient dense diet that is appropriate. And I've always, when I was practicing as a nutritionist, I was like, when your kids are small is your window of opportunity to educate them, because once they get big enough, it's over. They're off on their own kind of thing. So I love the piece of the diet. So diet. And then, so what are a couple of the other, lifestyle interventions that you feel are, it's share some pearls of wisdom from you.
No, a wake up call for me was sleep. I'm trained as a physician. Up until recently, I used to carry a pager, a beeper around, and I would be on call 24 hours a day, 7 days a week. And I would get called at all hours. And I thought it made me tough. I thought I was being brave and I was helping my patients. What I didn't realize, I was actually hurting myself and hurting my patients, because sleep quality is really, really important. And some people have jobs where they have to take call and things like that. But I think the damage that it does is really underestimated. I mean, you've done the studies with college students, metabolically healthy college students, and then you sleep deprive them and they become pre-diabetic. They're insulin resistance just from the sleep deprivation. So sleep quantity also, I used to, despite what Elon Musk says about 4 hours a night, the evidence is pretty strong now that most people need between 7 and 9 hours of sleep. It's a really sharp curve. And on either side, bad things start happening, like cardiovascular disease and basically the risk for all these chronic diseases that we talked about. So that's I think that was underappreciated by me, certainly. And so sleep quality and quantity as well. And then exercise, both physical and mental exercise, is really, really important.
100%. Okay. So I think, guys, first of all, get the book, because I think there's a ton of information in there. But I want to talk a couple of things that are kind of real hot points in this space right now, and one of them is statins. And you mentioned this in the book, around in the chapter on cardiovascular disease, I think it is, and
Hmm.
statins. And I'd love to hear your perspective because, I think that the tendency is to stay statin. Well, there's two tendencies. One is, oh, your cholesterol's high. Here's a statin. Off you go. See you later. The other one now, which is the polar opposite, is statins are evil. They must never, never, never be used. And my sense is that they should not be used as a necessarily, but there's probably a use case. There's probably places where they can be helpful. There's different types of statins. Somebody at the conference this weekend talked to me about something called phenylfibrate, which is a completely different class of statin that doesn't have the disaster profile that regular statins do. So I was hoping that maybe you could kind of share some information in that space.
Sure. Yeah. Well, my view is sort of, I think, more nuanced. I believe statins are overused. They have a role to play, but I think it's a much smaller role than they do now. And why are they used so much now? Because there's this belief, and I think it's a misguided belief, that LDL cholesterol is one of the most important risks for heart disease, and statins are drugs that lower LDL cholesterol. So it's one of the few tools we have one of the few pills we have to decrease the risk. So why not do that? I mean, the number one killer is heart disease, right? Why not take anything that will lower the risk of heart disease? Well, the hazard ratio, in other words, the risk for LDL cholesterol, it is a risk for heart disease, but it's a relatively small risk. Most people who come into the hospital with a heart attack have normal cholesterol, and so, and the other thing, the studies have shown that lowering LDL cholesterol can improve the risk of heart disease by like 1% or so. But there are other factors that are much more powerful, like metabolic factors, insulin resistance, fasting sugar, triglycerides or HDL cholesterol, which reflect the metabolically healthy lifestyle that I talked about. Smoking. Mm-hmm. Smoking is a much bigger risk factor than LDL cholesterol. If smoking causes heart attacks, what does that have to do with cholesterol, right? And
well, actually, you might end up with higher cholesterol because your liver will be damaged because
it's all sorts of interconnected things. But hey, wait a minute! It's the number one cause of death. I get a 1 or 2% improvement. I'll take a statin. Why not? Well, there are side effects. There are problems with statins. The side effects tend to be minimized in the advertisements to the physicians, and the benefits are exaggerated. They're quoted as 30%, which is something called relative risk rather than absolute risk, which is statistical alchemy that we talk about in the book and how they do that. The other problem is some disturbing studies have come out when they looked at large meta-analysis of people on statins, and they found that people on statins, they looked at overall death rate. The death rate from heart attacks did decrease by 1 or 2%. But hey, that's great. I'll take that. But they found something else that was in a lot of the studies that was bothersome, and that was the people who took statins, although they had a lower death rate from cardiovascular disease, from heart attack, they had a higher death rate, higher than normal for other things.
Yeah.
What other things? Well, suicide, automobile accidents, maybe things that are related to the way the brain functions. Well, the brain is made up of cholesterol, right? And the cell membranes and hormones are cholesterol. And cholesterol is such an important compound. So that they found that the so-called all-cause mortality with people on cholesterol, on statins, wasn't any different because they died of other things at a greater rate. So it's really complicated. And I would urge people to read about it. You can read in my book, or there are many other books about that. But statins, I believe, are overused.
Yeah.
And they're more powerful things we can do to decrease our cardiac risk.
Right. Like what?
Well, becoming metabolically healthy.
Yeah.
And lowering your triglycerides, raising your HDL, those are metabolic factors. Getting your glucose regulation in control. Those are important metabolically healthy factors. Exercise. I mean, quit smoking. Obviously, that's a key thing there. I should say again, same caveat. Don't stop your prescription if you're taking it, and have an honest conversation with your doctor. If you've already had a heart attack, then the dynamics change a little bit, and the advantages of statins may outweigh the risk, but I'm talking about for people who are put on them prophylactically, who maybe haven't had a heart attack and they just have a high LDL cholesterol. Then I think you need to look, really question yourself. Is it worth it? And question your doctor.
Well, and are there other things you can do? Right? Like, are you doing everything that you can to impact? Because even inflammatory status, like if you're inflamed, you're going to have a bigger chance of suffering from the negatives of high cholesterol or LDL. And even, what are your thoughts on doing a deeper look into LDL that is looking at particle size and oxidized LDL? Like there's a whole other story there. I mean, in the States, you can at least get the tests. In Canada, you can't even get a lipid panel that includes those metrics, which are really important, right? And I think it bears mentioning that unfortunately the pharmaceutical industry is having a massive impact here, because it seems like they keep working to drive the number down of what's acceptable, and the end result is more people end up on statins. And to your point, what the research is showing, that I think there was a study that showed people in their 80s and 90s with the lowest levels of cholesterol had the highest levels of neurodegenerative disease and even depression, just everything that you just mentioned. So it's one of those things that I think the consequences of oversimplifying it are really, really dire in many ways.
Yeah, and there's a test you can get called a CT calcium score, which is a scan. Unfortunately, it's not paid for by insurance in most states in the United States, but it costs about $100. You can go to an imaging center and request it yourself, but it measures the calcium in blood vessels of your heart, and the calcium indicates disease. And if you have, and it's scored from 0 to 1,000, if you have a 0 score, which means no calcium, the American College of Cardiology says that you really shouldn't be on a statin unless you have, a history of a prior heart attack or a first degree relative who had a heart attack before 60. So if you have a 0 calcium score, you can take that to your doctor and say, I don't want to be on statins, and here's my 0 calcium score that will, give them evidence as that as well.
Yeah. And I think that again, there's also physicians in that space, like cardiologists, who are becoming more progressive in their views. And it might not be simple, but finding those people and seeing if there are people that you can kind of tap into. There's books written by cardiologists who are starting to break the mold a little bit and saying, maybe we didn't have this all right all along.
And there's a great disagreement about that, and reasonable people can agree to disagree, but it's still a very, very controversial topic.
Yeah. And also other blood markers, like I think, is it ApoB? And like there's other blood markers that are starting to kind of be brought up as just as important, if not more important than LDL.
Yeah, particle size, you mentioned, you can order an NMR panel that will do that. And talking about empowerment of the patients now in the U.S., and I think in Canada too, you can order blood tests yourself that you pay for yourself, but you can, I have one on my website I do every week or every month. Basically, it's a finger stick, and they send me a little kit, and I put a couple drops of blood, and it does, ApoB, and it does, fasting insulin, cortisol, testosterone, all sorts of things. And these are available, fairly inexpensively. And so if your doctor doesn't order it or your insurance won't pay for it, hey, you think about taking agency and doing it yourself.
Yeah, 100%. I mean, that this landscape of home testing is really it's shifting fast. It's been building for a few years, and now it's like every time. I just came across a test recently that gives you, a value on how your mitochondria are working, how
Yeah.
efficiently they're working,
Yeah.
right? I'm sure you've
Yeah.
talked that they've reached out to you. I mean, it is remarkable
And
the advances in this space.
and the tests are getting cheaper. I mean, the one
Yeah.
I use is the it's about $10 or $15 per test, and it does 20 markers. And if I go to my lab, my doctor's office, and I want a fasting insulin, well, they'll go, oh, that's $80,
Yeah.
and
Yeah.
and I go, I'll pay cash, and they go, that's the cash price, and so there's all sorts of weird, medical system is just rife with strange billing practices and opaque billing things. So it's very, very frustrating.
Yeah, it is. It's a bit of a quagmire. All right. Okay, I think we're coming up. I mean, I have a list of about a lot of other questions I could keep asking you, but at some point I'm going to have to let you go. So, what are your thoughts on supplements in general? And are there any specific ones that you feel are actually really important for people to think about taking? And not that well, I mean, I think there's a few that maybe most people could benefit from, but what are your thoughts on supplements? And are there a few that you think really can be helpful for people?
Well, if people have a deficiency in things like, I mean, one of the tests that's included in mine is vitamin D. And, my vitamin D, I get out in the sun, but my vitamin D levels are low. So I take a vitamin D supplement, and I can see the levels, I can check it with the blood test, it goes up. And so if there's a deficiency, I think, no question a supplement is indicated. I don't think anybody would really question that. And the problem is, there are a lot of supplements that are just kind of, hey, for health or those kind of things. And there, I think, we really don't know if there's, if you're testing your NAD, if you're doing an NAD supplement, then the question is, how do you check the endpoints? With vitamin D, I can measure it, but with NAD, it's different. Maybe I feel better, I have more energy, or that might be the berberine I'm taking, or it might be the, something else. It's hard to tell. So, supplements, I'm not opposed to them. And I think there's a lot of possibility there. I don't think prescription medicine has any unique monopoly on powerful drugs. There are a lot of powerful drugs that are powerful supplements that don't require a doctor's prescription. Supplements are more challenging because they're not as heavily regulated as prescription medicines. So there's much more issues with purity, and try and get it from a trusted source if you can, because some supplements don't contain what they say they contain.
Definitely.
So, but
for sure, no, definitely. I think the shooting for the bottom, looking for the cheapest supplement you can find on Amazon, is a little bit, nothing against Amazon or anything, but that they themselves admit that getting rid of kind of filtering out all the stuff that is not what it says it is on the bottle is even beyond their capacity. So definitely,
yeah, absolutely.
I think that's very true. Okay, well, I think at this point, hopefully people are sitting there going, I'm going to order this book. I'm going to read it, and I'm going to kind of dive in. So maybe you can tell people where they can find you. And I know you've got your own podcast, and
sure.
so
Yeah. Hopefully you'll be on it soon. And,
I would love to.
Yeah. And in the book, if you want, you can download a free chapter, both in PDF and odd MP3 form. So you can listen to it, just see if you like the book. And it's my website is robertlufkinmd.com, and you just click on the lies part of the website, and it'll have a place you can download the chapter there. And I'm active on social media. Follow me there if you want.
And is it Dr. Robert Lufkin? What's your social media handle on Instagram?
Everything is Robert Lufkin MD. Everything is Robert Lufkin MD.
Okay, Robert Lufkin MD is
just added Twitch too. Not getting a big following there, but
Twitch. Okay, I don't actually even want to know.
It's a gamers platform, but we broadcast our podcast to it twice a week, so we're getting a few gamers that.
Well, gamers you could argue could use the book. They could use this information. They'll be better gamers, and there may be a few that could maybe use
Yeah, up their League of Legends score or whatever.
Exactly. Well, thank you so much for your time today. I really appreciate it. I know you're just coming off a conference. It's busy days for all the people, but I really appreciated the interview, and I love sharing your wisdom. Thank you so much.
Yeah, thanks, Natalie. This has been fun. I love the questions, and it was great talking to you.